Sandeep Jauhar, Heart, A History. Dive into the fascinating world of the human heart with Sandeep Jauhar's Heart, A History. This book's summary scrutinizes the impact of emotions on our physical hearts, explores groundbreaking medical advancements, and delves into the often underappreciated societal factors that affect heart health. Discover the history of the heart as a metaphor for love and courage, learn about medical pioneers like Werner Forssmann and C. Walton Lillehay, and observe the outcomes of groundbreaking studies like the Framingham Heart Study. This book summary aims to demystify the complex world of cardiology for readers of all backgrounds.
The heart as a symbol. Sandeep Jauhar's book explores how the heart has been used as a symbol of courage, love, and much more for centuries. From Renaissance Europe to the Middle Ages, Jauhar dives into the history of how the heart shape has become associated with emotions such as bravery, courtship, and sexual behavior. He uncovers how depictions of hearts found their way onto coats of arms as symbols of loyalty and bravery. Interestingly, he also explores how the shape of a heart, called a cardioid, occurs naturally in flowers and seeds, and was even used as a natural contraceptive. This intriguing history of the heart as a symbol will give readers a new appreciation for one of the most iconic shapes in history. The impact of emotions on heart health. The physical heart is significantly affected by emotional stress, as discovered by cardiologist Sandeep Jauhar during his practice in New York. Emotional matters such as fears and anxieties are often addressed to help patients alleviate the stress and prevent heart damage caused by constriction of blood vessels that increase blood pressure and heart rate. Statistics reveal that the heart is indeed sensitive to emotional stress. Jauhar even observed that loveless marriages may contribute to heart disease. Takotsubo cardiomyopathy is the medical term given to the heart's physical deformations caused by emotional stress, with women being affected more often. Symptoms of impending cardiac arrest, such as chest pain, breathing difficulties, and sudden collapse, are common, and some individuals may even die of grief. Groundbreaking self-experimentation. In 1929, Werner Forssmann, a medical intern, performed a revolutionary experiment on himself. Forssmann, with the help of a nurse, operated on his own heart using a catheter tube, which allowed him to monitor blood pressure and blood flow. The scan initially showed that the catheter had not yet penetrated the heart. However, Forssmann persisted and eventually succeeded. His work laid the foundation for later developments in cardiac operative techniques, such as coronary angiography. Inspired by Forssmann's work, two American cardiologists, André Cournand and Dickinson Richards, developed their own techniques that helped in the diagnosis of cardiac illnesses. Forssmann, Cournand, and Richards shared the Nobel Prize in Medicine in 1956 for their groundbreaking work. A pioneering surgeon's revolution. A surgeon named C. Walton Lillehay developed a cross-circulation system for heart operations after being inspired by babies in the womb. He experimented on dogs and successfully linked their circulatory systems using a beer hose and milk pump. Lillehay's revolutionary system allowed for heart surgery to become possible for the first time. Cross-circulation surgery. In 1954, Dr. Lillehay identified the group of patients with congenital heart disease, most common in newborns, who would respond best to his experimental cross-circulation surgery. Congenital heart disease caused leakage, reducing oxygen in the blood, resulting in fainting fits or even death. However, stopping a patient's heart for more than 10 minutes was practically impossible. Lillehay's innovative technique involved connecting the patient's circulation with an adult's, whose blood kept the patient's organs alive. Lillehay's first patient, 13-month-old Gregory Glidden, had a successful 14-minute operation to stitch up a coin-sized aperture in his ventricular septum but later developed a chest infection and died. However, by the end of that year, Lillehay had performed the risky surgery on 44 more patients, and 32 of them survived. Lillehay's cross-circulation surgery marked a significant turning point in treating congenital heart disease patients, saving many lives. Framingham Study and the Rise of Preventative Approaches. The Framingham Heart Study was established in the 1950s to understand heart disease by monitoring the lifestyles of 5,000 citizens over 20 years. The study debunked the idea that anxiety, stress, and benzodrine use were primary causes of heart disease. Instead, it established a clear connection between lifestyle factors such as high blood pressure, hypertension, cholesterol levels, and heart disease. Smoking was also identified as a major risk factor. As a result, cigarette advertisements were banned, warning labels were placed on cigarette packages, and doctors increasingly relied on preventative approaches to tackle heart disease. The study's success demonstrated that a healthy diet, exercise, and abstinence from alcohol and nicotine could make 4 out of every 5 cardiac arrests entirely avoidable. The multifaceted causes of heart disease. The Framingham study sheds light on the various factors that contribute to heart disease, beyond just diet and exercise. Further research shows that psychosocial factors such as cultural integration, income, and security play a significant role. It is clear that a comprehensive approach to prevention is necessary, including individual lifestyle changes and social reform. The Framingham study was groundbreaking in identifying the causes contributing to heart disease, but it was not without limitations. While it provided critical insights on the effects of diet and exercise, it only looked at a white middle-class population based in one suburban U.S. town. When the study was expanded to include other populations, researchers discovered that there were more complex factors at play. Indian and South Asian populations, for example, had higher rates of heart disease despite having lower cholesterol, lower blood pressure, and healthier diets. Studies suggest that psychosocial factors such as culture and socioeconomic status also contribute to heart disease risk. Research conducted on Japanese immigrants in San Francisco found that those who integrated with Western culture experienced a higher prevalence of heart disease compared to those who remained tied to their cultural heritage. Similar results were seen in studies on Black people living in low-income communities. The chronic stress and anxiety experienced in these situations was found to increase the risk of heart disease. These findings indicate that a multi-front approach is necessary to prevent heart disease. While lifestyle changes such as exercise and healthy eating are important, social reform is also needed. Improving cultural integration, income, and security can reduce the stress and anxiety that contribute to heart disease risk. By addressing the complex and multifaceted causes of heart disease, we can take a significant step towards combating this widespread health issue. Eradicating fatty plaque. In the 1960s, American medical professionals faced a significant challenge as fatty plaque clogged people's arteries, leading to health problems. After various studies, it became clear that high cholesterol levels led to heart disease. The cholesterol particles are deposited in the blood vessels and react with oxygen, producing highly reactive free radicals. Damaged cells send chemical signals, and white blood cells attempt to swallow up the cholesterol particles, leading to further harm. Andreas Gruenzig developed the solution in the 1970s, known as balloon coronary angioplasty, which involves inflating a balloon that stretches the artery and dislodges the fatty plaque, saving many lives worldwide. Thanks to the pioneers in medical surgery, medical technology has continued to advance, allowing for greater benefits to humanity.
Sandeep Jauhar's Heart, A History highlights the incredible advancements in cardiology and the unbreakable connection between emotions and the human heart. From metaphors of love and courage to the rich history of medical innovations in cardiology, Jauhar teaches us that there is immense power in understanding our own hearts. This book's summary reminds us that emotional stress impacts heart health and that our approach to combating heart disease must be multifaceted, incorporating lifestyle changes and social reforms. By better understanding our heart's vulnerabilities and embracing medical breakthroughs, we can improve our overall well-being and, ultimately, save lives.